Hello, I'm Dr. Abhishek Katha. I'm a consultant general and advanced laparoscopic surgeon working at Lux Hospitals, Gachibowli, Hyderabad. Hernias come because of protrusion of abdominal organs through an abnormal opening. So basically the main causes of hernias being obesity or lifting heavy weights or strenuous work or chronic cough. All these are the symptoms by which the patient will present with before he develops a hernia. So any hernia which is obstructed will have more severe symptoms compared to the non-obstructed hernias. And the main cause for hernia these days is either because of obesity or because of lifting heavy weights. And sometimes the patients also present with muscle weakness which is inherited in her body, due to which he will produce the hernias. So the diagnosis of hernia depends mainly on the examination physically and also by investigations. So by examination, we first examine the patient whether he has a swelling, in which location is the swelling, and whether the swelling is getting reduced or not reduced. That means the patient has to lie down and then stand and show us whether the hernia is getting reduced upon standing or on lying down, whether the hernia is not getting reduced even after pushing by hands. So the complicated hernias usually do not get reduced. That is why the patient produces severe symptoms in these cases. Hernias are usually operated in two different methods, the open conventional method and minimally invasive methods. The minimally invasive methods which we usually do is advanced laparoscopic surgery, which is very advanced these days, and then the most commonly performed surgery technique. So these days we follow an advanced laparoscopic surgical technique for operating all hernia patients. That is because in these cases the patient will experience less pain, less scarring and early recovery. There are different types of hernias like inguinal hernia, umbilical hernia, incisional hernias, femoral hernias and epigastric hernias, out of which inguinal hernias and umbilical hernias are the most common. The symptoms of these hernias differ whether the patient has obstructive symptoms or non-obstructive symptoms. That depends on whether the hernia is complicated or non-complicated. Usually complicated hernias present in the form of obstruction, where the patient will have vomiting, nausea, constipation, severe pain, etc. Whereas uncomplicated hernias present only with a swelling or pain. Among these hernias, those which are serious are those which are obstructed, especially in case of inguinal and umbilical hernias. Hernia mesh is a synthetic material that is used in the repair of hernias, and this technique is done for almost all the hernias by you placing a mesh placement, because the body as it is might not be able to produce proper support because of the weakness of the muscle. So in these cases we put a synthetic mesh for all hernias so that extra support is given to the hernial areas. Hernia surgeries can be performed with mesh and also without mesh, but then usually we do it with mesh because the chances of recurrence when we use a mesh is much less compared to no mesh usage of the surgery. So if at all a patient is having any complications because of the mesh that we put, then those are the patients which we do not put a mesh, especially for patients who are not fit for surgery or by putting a mesh. So we always advise you to put a mesh in those patients who are eligible for putting the mesh. In some cases, we do not put the mesh when there is no fitness of the patient, or in those cases where the mesh cannot be placed due to several other reasons. In those patients where we do not put a mesh, we do an anatomical repair in which the body tissues are approximated on one another and then gives the extra support. In these patients, the mesh will not be placed, but still the body tissues will be approximated in such a way that they give an extra support and then does not cause any recurrence. But the chances of recurrence by doing an anatomical repair without a mesh is much higher when compared to those patients in which we do a mesh repair.